Now, starting with another physical function of the PDL is basically transmission of the occlusal force to the bone. How the occlusal forces are transmitted to the bone actually. So, first of all, they are saying that the principal fibers arrangement are uh, is a very big hallmark in this. They actually play a very huge role in this. First of all, when axial forces is applied to the tooth, so there is actually a displacement of the root in the alveolus. So when force is applied on the tooth, so basically the root will displaced in the alveolus. In this way, oblique fibers are wavy. They become untense pattern and assume their full length and sustain the major part of the axial force, means they tolerate these axial forces. When horizontal and tipping forces are applied, okay, so basically horizontal forces is actually the combination of the means the horizontal or tipping force. Horizontal force, but tipping force is actually the combination of the rotation and translational force. When it is applied on the tooth, so the tooth moves in two directions. Either it is just confined to the pedial, or the other it displaces the facial lingual bony plates. The tooth rotates about their axis. They may change as the force is increased. The apical portion of the root moves in a direction that is opposite to the coronal portion, is actually tipping force. Okay, in this area of tension, the principal fibers, they become are taut rather than they wavy. When there is a pressure, the fibers are compressed and the tooth is actually displaced. Okay. Okay. Okay, so the area of pressure, these fibers are compressed and the tooth is displaced. Corresponding distortion of bone also exists in the direction of root movement. What happened in a single root teeth? The axis of rotation is located in the here. I will tell you a picture. This is actually, and you see this. This is actually the axis of rotation in a single rooted teeth. Okay, so basically it is present between the apical third and middle third of the root. Now what happened, that the root apex and the coronal half of the clinical root has been suggested as other location of axis of rotation. The pedial, which has a hourglass shape, is narrowest in the region of axis of rotation. In multi-rooted, the axis of rotation is actually located in the bone between the roots. Okay, between the roots. Now, in compliance with the physiologic mesial migration of teeth, and the pedial is thinner in the mesial root surface than on the distal surface. Okay.